Hi everyone, it's Michael Tubbs with Brookdale Potomac Senior Living. We're lucky today to have Teresa with us from Fox Rehab. She's going to talk a little bit about home health and some of the changes that Fox Rehab has implemented due to the COVID-19 virus. So once again, Teresa, thank you so much for joining me today.
Thank you, Michael. So as Michael said, I'm a physical therapist and I'm the regional director for Montgomery and Howard County in Maryland for Fox Rehab. So for those of you who are unaware, Fox Rehab, we're an outpatient therapy provider. We provide services for physical therapy, occupational therapy, and speech therapy. And we bill under Medicare B. So we specialize in geriatrics and serving older adults in the community. And one thing that makes us special is that we're outpatient on wheels. So we have a very unique model that we provide house calls to our patients. So we're not the true home health in the sense that you're used to hearing about a home health therapist, but we do provide services in the home for PT, OT, and speech. So we are currently in 20 states, and we are a very large private practice that serves older adults and bill under Medicare Part B services, which is the same as if you would go to an outpatient clinic. And the secondary insurance, Medicare Part B covers 80% of all of the charges, and then a secondary insurance would cover all or part of the remaining 20%. So with that, we are also, besides being in homes, we are also rehab providers in certain senior living communities, and we do partner with Brookdale Potomac. So that's how Michael and I know each other. So we have a big, beautiful gym in Brookdale Potomac, and we staff it with full-time PT, OT, and speech, and we serve the residents in that community and all of their rehab needs. So one thing that I think might be important to kind of talk about is what types of people do we see, and how do you know if someone needs services, especially because we do serve the older adult community. So we like to look at things on a scale of, we call it the fun, functional, the scale of the continuum of wellness. So they all start with F, and it kind of helps you remember on this scale, like fun, functional, and then it would go to like frail and failure. So we want to keep everybody in that functional and fun part of the spectrum of your overall health and wellness. So a lot of what we do can be preventative. We want to see people before they end up falling and needing services, in a rehab center, acute, or a hospital. So keeping mom and dad, keeping yourselves, if you're a little bit older, in that good shape so that you're still able to do all the things that you want to do. Dr. Tim Fox founded us 20 years ago, and he talks a lot about ageism and how ageism is kind of that discrimination against people who are older just because of their age, where we talk a lot about keeping people healthy and enjoying what they want to enjoy in life, no matter how old they are. So one of the things that we do is we put together success stories when we have our patients, and we're working with them, and we ask them, what do you want to work on? And then they come up with some goal, whether it's getting back to gardening or walking a golf course or just doing something they haven't done in a while. And we might take pictures and put together the success story. And it's just kind of a nice way to highlight that they are really able to enjoy something, and no matter what age they are, that we really try to accomplish goals that are very patient-centered and things that they want to work on towards an end. So one of the differences between us and home health is that our sessions are average about an hour, and our certification periods for Medicare, we start with our 90 days. So we are able to see people, the evidence shows 3 times a week is the really optimal for improving people's strength and flexibility and balance in this population, depending on what their diagnosis is. We, customize each and every session and every patient, but 3 times a week is kind of what the evidence shows is optimal. So with that, that's a lot of time that we're spending in the home or in their, in their environment where they are working on things that they want to accomplish. So we have an interdisciplinary approach too, where physical therapists, occupational therapists, and sometimes a speech pathologist will also all be working with the same person, not at the same time, but within the same episode, and schedule those visits throughout the week together. So, some of the things that would warrant an evaluation that you could have us come out for, and then I'll talk in a minute about how do you get a referral, how do you get a Fox therapist to come see you. But some of the things would be, just generalized weakness, of course a fall, but we would like to see somebody before they fall. So if you feel like your balance is a little less optimal than it used to be, or if you've stumbled a little bit, or if perhaps you have had a fall, or you can't stand on one leg for half a minute, just different things that you've noticed, then maybe it's time to have an evaluation. Of course, weakness, sometimes dizziness, lots of different neurological conditions can trigger a need for physical therapy. Of course, if someone has dementia, Alzheimer's, or Parkinson's, I mean, there's a lot of different diagnoses that we treat, but these types of things. So working on, like a physical therapist works on, your mobility, your balance, strengthening. Pain is another big one. If you have any kind of joint pain, even people with chronic pain respond well to exercise and instead of just medication. And then occupational therapists. So people often say, well, I don't have a job right now, I don't need an occupational therapist, but the occupational therapists really work on the activities of daily living. So they help people get back to doing things that are part of their normal lives that are maybe becoming more difficult, like even just bathing, grooming, dressing, managing their kitchen, even feeding their pets, using a remote control, their television, handling a phone call. It's kind of the sky's the limit with different things to help people with whatever it is that they need to learn to manage in their everyday, ordinary lives. And then a speech pathologist. So some of the conditions that a speech pathologist would work with is if they're having problems with swallowing. Maybe you've noticed every time they take a sip of a drink, they're starting to cough a little bit. So that would be a case of a more urgent need, because you, of course, want to make sure that there's no aspiration happening where someone could get pneumonia because some of the liquid is going down the wrong way and can fill up into the lungs. Or speech pathologists are also working with, of course, what everyone thinks of with a speech pathologist is helping with an actual speech and the language. Maybe their voice has gotten really soft, and kind of working on that, or in the cognition part, when someone has difficulty with memory or sequencing and processing things, speech pathologists can put together a plan and help people with their speech and their, in the sense of their memory and cognition. So lots of different things. I know I'm just skimming the surface on what would trigger a need for PCOT or speech. But basically, if there's anything that you want to do that you used to do that you haven't been able to, there's probably a therapist that can help you attain those goals. And then with a referral, so with Fox and pretty much any outpatient services, we do need to bill Medicare. We need a physician's signed referral. So just it can be as simple as PCOT, speech, eval and treat, and then we can take it from there. And so we do have account managers that can help with getting that as well. So really just a phone call to someone in Fox. We also have our, foxrehab.org. We have a website, but mainly just asking, and most of the physicians in the area, we have relationships with them and they're aware. So it's a matter of just we can help you with that, but getting that referral, and then we take it from there. So, so as far as right now and what's going on with the coronavirus and the pandemic, we are still very active. We are treating people in their homes. We are treating people in Brookdale. Things are different than they used to be, in the fact that we always use universal precautions and wash our hands, but now I think when you see your therapist coming, the biggest difference that you would notice is all of the personal protective equipment, or you've heard the word PPE. We're looking a little bit different physically in the fact that we are very much trying to protect you and ourselves from the spread of the virus. So we are now wearing surgical mask and gloves, in some cases gowns, and we're going to be starting next week. We're going to start wearing face shields. So just to really protect between, so that we're not transmitting it. But thankfully, due to the diligence of all the clinicians out there in the field, we have had a lot of success with treating all of our patients that want to be seen and without any issues at all. So everyone is very careful to take all of the necessary steps to keep you safe in your home. And really, we have been I think, very instrumental. We're very essential in what's going on right now, because we are helping keep people out of hospitals. We're helping keep people out of rehab centers. We're keeping them healthy in their homes, and which, right now there's all of you are in your home, nobody's going anywhere. So especially for the older population, and for all of us, like, we all need exercise and movement and mobility, because if you don't use it, you lose it, right? But so just being able to kind of have that skilled clinician come in and have that customized plan of care that is under the guidance of your physician, just to be able to continue to keep you mobile and active. It's really also a good defense against any future respiratory problem that you could get. Keeping your heart and your lungs strong and healthy is essential right now, and fighting off anything, especially COVID-19. So that's kind of what we're doing. We're just big part of my job right now as a regional director is just making sure the team has enough PPE. You've heard about the national shortage. A couple of weeks ago, my daughter helped, she basically made some homemade hand sanitizer, probably during the couple of weeks where it was just almost impossible to find it anywhere. You can find really high grade ethanol alcohol and mix it with aloe, and it has to be over the 60% alcohol based. But these are the things that I never thought would be in a job description, but it's what we're doing right now to keep everybody safe and healthy and functionally well. So yesterday, one of the physical therapists on the team, she shared, we have these success stories that we do, and people are doing great. I talked about that before, but there's a woman who had her knee replaced right before everything started, all the quarantine started, and everybody, before people had really even heard much about the coronavirus, she had just had her knee replaced. So she knew about Fox Rehab. So we were in there treating her in her home right after she came back from surgery. I think we started off like 5 days a week just because she had this brand new knee. But we could have continued. So just yesterday, she put together this success story, and it's a great picture of her she's got her mask on and she's walking down the stairs, and she wrote up this little blurb about how grateful she is to Fox for helping her during this time of pandemic, because she's been able to stay in her home. She didn't have to go anywhere and be exposed unnecessarily. And then she's just so proud to be walking up and down the stairs, and she's not using a cane anymore. So things like that, you see those, and they're very heartwarming, and because it can be difficult to be out there in the front lines and wearing all this equipment and treating people, but it's very necessary. It's very essential right now to keep people safe and to free up those necessary hospital rooms for those that need it right now. So yeah, I don't know if you have any questions.
Do you mind if I just ask for two quick ones that came up when
yeah. Mm-hmm.
Can you just go over, I've found a couple people get a little confused, the difference between Medicare Part A and Medicare Part B and how that all works.
Sure.
Can you just provide some clarification just in case other people might have questions like that?
Sure. So Medicare Part A is your acute care benefits. So hospitalization, home health, a rehab right after the hospital. So those are the benefits that are when you can think about it, like if something happens and you need to go to the hospital and then some therapy inpatient right afterwards. So those are basically your inpatient benefits. So Medicare Part B are your outpatient benefits. So when you go visit your physician, if you would go to an outpatient clinic for something, those are all going to fall under Medicare Part B. So in the world of therapy, obviously there are therapists in the hospital, in rehab centers. There's also home health therapists, and then there's we bill under Part B, because even though we're in your home, we're like an outpatient clinic on wheels. So we come to you. And
that's
so
the same here.
The difference with
Potomac too. We're
correct
at Medicare Part B, not Part A, even though the gym's in the building.
Absolutely, because that's their home. So it's not, and that's how we look at it. Fox Rehab we do not provide care in nursing homes. We are not in acute care rehabs or hospitals. We're outpatient. And so we're in senior living communities at Brookdale, which is someone's home, and a nice one. So that's kind of how it's picture it, like an outpatient clinic right there in their home. It's like its own self-contained little village. Exactly. So that's why we would bill Part B, even though we're in a residence. Mm-hmm.
Good to know.
Yep.
The other question I have, and you might have heard of this, so you might have someone at home right now, and they're, losing, endurance or stamina, or they might be having back issues, or any of the red flags you kind of shot up in the beginning, and they need to get that doctor's orders. Have you had any experience with doctors now doing virtual calls for appointments and able to giving orders for home, health over a virtual doctor's appointment?
Absolutely. And that's a great question, because with home health, you need a visit within 30 days to the physician, an actual appointment. With an outpatient billing model, you don't actually have to have that appointment. So they can actually refer without having seen you within a certain period of time. If they want to see you, absolutely. There's a lot of physicians right now setting up telehealth appointments. So Medicare is now at the physician level reimbursing, I believe, for telehealth. So I was telling Michael right before this call, I personally had a telehealth appointment to get a primary care provider set up, because mine moved out of state, and I thought this is not the time to not have a physician. So I had a telehealth appointment, because a lot of the offices don't want patients in and out right now. They're trying to protect everybody. So absolutely, there's a lot of ways. I think most offices still, people are answering the phone, and you can call your doctor and say I need therapy, and we are. The physicians know that we're very much there and available and able to help people in this situation, and they don't have to have the patient come in and see them. And we're, of course, we assess everybody, and during our evaluation, if we determine that they need something a little bit more like home health based, whether it needs to be a nurse coming in to manage medications or a higher level of acuity than we handle as outpatient therapists, then we would refer back to our home health friends.
Okay, perfect. Well, I think that clears up a whole lot for a lot of people who are just learning about home health and then what services Fox can provide. So thank you for providing all that information. It's really
Absolutely. Absolutely.
well. If anyone else watches this and has any more questions for about Fox Rehab or for you, what's the best way that they can contact you or to contact Fox in general?
Sure. I'll give them my my cell phone. So it's 443-632-6447. Again, that's 443-632-6447. Or they can look us up on the web at foxrehab.org. So those are probably the best ways right now. But I'm happy to talk to anyone individually if they have specific questions.
Perfect. Well, Teresa,
Or stop by Brookdale, right?
yes,
and we're
always
there.
feel
We
free
have
to
a big
give
gym.
Brookdale a call. Yep.
That's right.
Well, perfect. Well, Teresa, thank you again so much for joining me today. It was a pleasure speaking with you, learning more about Fox, and I hope everyone out there stays safe and healthy throughout all of this.
Absolutely. All right. Thank you so much, Michael.